Hello, wonderful humans, and welcome back to the Art of Chronically. I wanted to take a quick minute to talk to you about CIDP, or chronic inflammatory demyelinating polyneuropathy. This is a neurological condition that I actually live with, and I wanted to just take some time to share some education about this disease. So before we get it started, I do want to remind everyone that I am not a doctor. I did not go to medical school. All of my information comes from personal experience and personal research, as well as conversations with doctors, nurses, and other medical professionals. So if you are seeking diagnosis, treatment, anything like that, I am not a medical professional. I'm not trained as a medical professional. I'm a certified yoga teacher, but that's about as close as it comes. So this is personal experience and personal research that I'm sharing with you, and I just want to make sure that you know that before we get started. So, what is CIDP? It is a neurological disease or condition that affects the nervous system, specifically the peripheral nervous system. And what happens with CIDP is that you have inflammation in the body, and they don't really know where the inflammation comes from. Like, there isn't a known trigger or catalyst, but inflammation happens in the body and it attacks the nerves or the nerve stem, like the nerve base, root, the root of the nerve. And what happens is the inflammation causes the protective coating on the nerve to actually disintegrate or demyelinate, because the protective coating is called the myelin sheath. So the demyelinating polyneuropathy, chronic inflammatory, inflammation-based demyelinating, the myelin sheath, the protective coating, dissolves, disintegrates as a result of inflammation, resulting in polyneuropathy, or basically, in the most simple way, without the myelin sheath, your nerves don't communicate properly, so the nervous system has a communication shutdown. And what this means is your messages don't get sent correctly, and yeah, you know what happens. Communication meltdowns are never a good thing. So the symptoms of CIDP vary from person to person and can be very cyclical, meaning that at times they are much worse, and then at times they are better, and we don't really know why. So this makes it really tricky to diagnose and also tricky to treat, because it can kind of flare up for no reason, and every person responds differently and has a different physical experience within it. But generally, the symptoms are weakness, numbness, pain, fatigue, and slow reflexes. And particularly the weaknesses in the limbs. And then I've noticed I have a lot of numbness in my hands and feet, and I have a tremor. I also experience a lot of sensory issues. Sensory overload is real and it is horrible. But a lot of patients will develop like a drop foot or a hand that no longer works. So again, it can affect people differently. I have the left side of my face will slump when I'm having some symptom flaring. But generally it's pain, weakness, coordination, balance, and it's very painful. It's very painful. So within that, to prevent further damage, the sooner you can start treatment, the better. So it can be hard to diagnose, and I know that that's frustrating, that the sooner to treat the better, because sometimes we wait years for a diagnosis. But if you or someone you love has been diagnosed, I do recommend that you don't hesitate on starting treatment, because the sooner you start treatment, the sooner your body will stop attacking the myelin sheaths and you can start to rebuild, and you won't have as much damage or nerve loss. So that's definitely important. In terms of diagnostics, it is a very difficult condition to diagnose, because there isn't like a specific diagnostic test where they can check for one specific thing. So what happens is you have to have been symptomatic for at least 8 weeks, and then a neurologist will ask you a bajillion questions and run every test you can think of. I think the ones that finally helped them with me was a nerve conduction study and a leg biopsy, but they did, I can't even tell you how many tests. And then oftentimes they use basically just the process of elimination to diagnose CIDP. And then once they start treatment, if you respond to treatment, then they know that they've given you the right diagnosis. Because as I said before, it presents differently. It's hard to diagnose for sure. So sometimes the best course of action is to try to treat it and see if the body responds, and hopefully it does. So the ways that they treat it most common are with corticosteroids and IVIG, globulins. I always call them immune goblins because I think it's funny, but then when I'm trying to say it real, I can't. So whatever, IVIG. So those are the two most common, is the corticosteroids and the IVIG. But I did some research, and actually you can also treat it with plasma exchange, immunotherapy, and stem cell transplants. I've never tried any of those, but the goal of all of these treatments at the end of the day is really basically to slow down, interrupt, or reset the immune system, because your immune system is causing this inflammation that's causing your body to attack the myelin sheath. And if we can get that to stop, then you're not going to have any more demyelination happening, and you're going to be able to start to try to rebuild some of that nerve function. With that said, along the lines of rebuilding, sorry, I'm getting a little tongue-tied. It's possible and probable that your doctor will recommend physical therapy and moderate exercise to keep up strength. And I'm like a huge proponent of both of those things. So if you feel like you would benefit from physical therapy and your doctor hasn't recommended it, ask. Most insurances should cover it, and it's a great way to get comfortable with exercise if you are like, what do I do in this body? Let's see. Yeah, that's kind of CIDP in a nutshell. It's a condition that's got a lot of uncertainty, and sometimes your symptoms are going to feel really manageable, and sometimes they're not, and sometimes you're going to feel really great and strong, and sometimes you won't. And that's okay. That's the nature of the condition, and if you know and accept that, it makes it a lot easier, or at least it has for me. And some people will make a full recovery from what I hear, but they will always have some degree of nerve damage. So I say just embrace the body you have today and where you are today and move forward. So that's a little bit about CIDP. If you have any questions, let me know. And up next is a video about my personal experience with it. So thanks so much for joining me, and I hope you have a wonderful rest of your day.